Hello. Before I started my IVF treatment, I was worried as well, and maybe a bit scared, but I got over it very quickly. Lucky the doctor prescribed ALTERMON injections for me as well. Let me show you how it's done. It's not difficult at all. ALTERMON is used to stimulate the ovaries to produce many eggs at the same time. It is available in a box of 75 units. ALTERMON do not need to be refrigerated. They can be kept at room temperature and protected from light exposure. I personally keep them in my drawer. Each pack contains 1 vial of powder and 1 vial of solvent. To do the ALTERMON injections, you will also need to purchase from the pharmacy 2.5ml disposable syringes with large removable needles to draw the medicine, and small thin needles suitable for subcutaneous use. Now, when to inject. ALTERMON should be done at the same time every day. Choose a fixed time in the afternoon between 5 and 8 PM. Here we go. Wash your hands thoroughly with soap and water. One last check that we have everything in hand, and off we go. Take the powder vial and remove the cap. Then take the solvent vial and tap it lightly on top to remove any liquid that may be on the tip. Break the ampoule at the marked point by applying constant pressure, as if trying to fold the tip. If you did it exactly where the mark is, the ampoule will break easily. Next step. Insert the syringe needle into the solvent vial and draw all the liquid by pulling the plunger. We will now transfer the solvent into the powder vial. Hold the vial with the powder and pierce with the needle in the centre on the rubber stopper. Slowly and gently push the plunger of the syringe and transfer the liquid until it is completely empty. With gentle rotating motions, mix the solution until it is clean, clear and free of particles. Now turn the vial upside down and draw the liquid by slowly and carefully pulling the plunger. For easier suction, lower the tip of a needle into the gap in the inner side of the rubber stopper. Before removing the needle, make sure that you've drawn all the liquid. What if your doctor's recommended a higher dose than 75 units? For example, if your daily dose is 150 units, then you should inject the solvent into 2 vials of powder. If your daily dose is 225 units, you should inject the solvent into 3 vials of powder. While if the daily dose is 300 units, you should inject 2 solvents into 4 vials of powder. When you're finished preparing the liquid, remove the large needle from the syringe, discard it and insert the small needle. Remove the small needle cap and hold the syringe without the needle upwards. Tap lightly to help any air bubbles rise to the top. Then gently push the plunger so that the bubble comes out. If you need to place the syringe down, make sure you put the protective cap back on. And now, onto the injection. It is not as difficult as it seems. The injections are done in the abdomen, in the smile below the navel, 2 to 3 fingers right, left or down at a different point each time. Pick the spot and clean it with some cotton and alcohol. Lift the skin in the area, insert the needle with a steady and firm motion, vertically or diagonally. No worries, it is very thin. Now push the plunger gently and continuously, without stopping, until it stops coming down. When the syringe is fully empty, remove the needle from the skin. That's it. Gently press with the cotton on the injection area and massage lightly for 2 seconds. Close the needle with the protective cap you've held aside. Used syringes should be disposed of in a special bio-waste bin. If you do not have access to one, keep them and ask Embryolab to be discarded safely through their biowaste management system. See? It wasn't that hard after all. Here, you can find some more useful tips. For any other questions, you can always contact Embryolab.